phase of the digital revolution, Industry 5.0, is already here, people working alongside robots and smart machines. Researchers at the Australian National University are calling this transition the Internet of Bodies, saying it's game-changing and moving at a breakneck speed. Dr. Catherine Ball, Associate Professor from the School of Engineering at the Australian National University, believes that mobile phones, for example, won't be part of our lives in 10 years' time as the tech industry accelerates. She joins us now with more. Dr. Ball, welcome. Now, mobiles are, of course, a must-have right now. I'm not sure I could live without mine. It is hard to imagine life without them. What's going to replace them?
Well, if we think about the speed at which technology is going in terms of miniaturization, if I take you off maybe into a Star Trek-like universe, you remember how they used to have the little comms badges? Well,
yes.
I have a wonderful conversation with the great late Carla Zampatti about how we need drones and mobile phones as little beautiful brooches that look gorgeous as well as actually being form and function. And so the idea is that we'll have miniaturization. Now at ANU, we've already developed a mobile phone that's as thin as a piece of paper. So imagine now that you can literally just strap something on you, or you'll be wearing something that will maybe beam something onto your arm so you can actually see it visualized there. The next stage of the Google Glass is now a Google contact lens, which is powered by the salt in your tears. So there's something poetic about that. But the idea that we'd almost have Terminator technology and that we'd be able to look at things and see things. So the communications platforms we will still be using, the social media we will still be using. We know that Snapchat had their Snapchat sunglasses, for example. We're seeing a lot of patchy forward moving away from actually having a physical device in our hands. So implantable chips, I actually think aren't going to happen. We're using our facial recognition technology a lot more to access services. So it may be that we don't need our phones to pay for things because the till can register our face, or the trains can register our face, or the supermarket registers our face. And of course, this already exists in some other countries across the Asia-Pacific region, though not quite in Australia yet.
And Catherine, this is not just about the technology itself when it comes to communication, it's also about the technology when it comes to batteries. Because if you've got, a mobile phone that is as thin as a piece of paper, you're still going to need to charge that somehow.
Well, this is where you might use your body as the battery. So if we think about, even really nice watches that have that sort of kinetic energy that they use to charge the battery on, and then you have to make sure you move your watch, otherwise the battery dies. Just imagine that there'll be kinetic energy. And don't forget, one of the biggest things about this is we are racing towards quantum now. And there's been some great advances out of Sydney in just the last couple of weeks around the very first ever quantum circuit has been now completed 2 years ahead of schedule. So the technology that you and I are familiar with, that we live and breathe and we have around us in our lives. Look how far that's come in the last 10 years, and then shrink that acceleration down into one. And just imagine in 5 or 10 years' time what this is going to look like. So when I say something as clickbaity as there will not be mobile phones as we know it in 10 years' time, that's actually incredibly logical when you think about the speed and acceleration and the miniaturization of technology and how we power that technology.
How does something like the smart contact lens work? Something that you mentioned a little bit earlier in our conversation.
Well, again, this is all Wi-Fi connected back to a hub type system. So it may be that we wear like a smaller device that's the actual communications hub that's working within the Wi-Fi network. But effectively what it is a projector of information onto that lens. So you know how typically you would say, and I'm about to say it, so I'll probably switch my phone on. You would typically say something like, "Hey Alexa" or "Hey Siri," and then ask a series of questions. Well, she hasn't activated, that's good. That kind of thing is we are now getting to less and less hand control and more facial and verbal stimuli for our technology around us. So this is I suppose if you think about mobile phones in the late 1980s when they were carrying around those big battery packs, I bet they always wondered how on earth you would actually have a battery that would fit inside something this size. So just to accelerate that and be a little bit sci-fi maybe about it, or a bit prescient about it, the way in which these things are going to be powered and work kind of already exists. It's just not yet quite scalable. So just imagine that you would say, "Hey, eyeball, call my mom," is perfect. Let's chat in 5 years' time and see if it's actually happened, but I don't think we're that far off it.
Yeah, that sounds quite strange. I'm going to show my age, but I remember having a car phone which was connected to the car battery with a cord. Anyway, moving on from that, let's take a little bit of a broader look out here at the moment, Catherine. Tell me what your definition then is of the industry change in itself, so Industry 5.0.
So Industry 5.0 really for me comes off the back of what Abe came out with in Japan, which was after 10 years of a reasonably stagnant economic growth. One of his last bastions of ideas of how do we increase our economic growth is to look at how technology can actually be fit for purpose for people rather than we work for technology or technology work for us. And those of us that sit with overspilling email inboxes can well like this idea of, am I working for my email or is my email working for me? And so the idea that we'd actually build full technological services sat around a business model that's in purpose. So let's look at medicine, for example. We've got a shortage of nurses, a shortage of aged care specialist nurses, or one of the biggest risks to those healthcare workers are actually slips, trips and falls and back sprains, for example. Why doesn't everybody who works in aged care have access to exoskeletons, where they're then able to lift very heavy patients or patients in awkward positions to prevent them from getting those kinds of injuries? When we look at, in Japan, for example, you're not allowed to have cameras on you, and CCTV is monitored in a very different way to the way it is in places like Australia and New Zealand. So to have a smart apartment for maybe an aging relative, and of course, people want to stay in their homes as long as they can. They don't want to go in aged care facilities prematurely. You're not allowed to have cameras on them. So what do you have? Well, the sensors are in the floor. The sensors are in the walls. We even have smart toilets now that can tell you if you've got diabetes or if you're dehydrated. And so, we are collecting bodily information through all of these sensors. And then we look at some of the healthcare robotics that were actually already deployed in the last few years during the COVID-19 pandemic. So when you first walked into a hospital in China, for example, you were greeted by a robot that took your face measurement, took your temperature, gave you a unique ID, and was that kind of first line of meet and greet when you went into the hospital there. How we actually, when we've got a shortage of workers and a shortage of skilled staff, how do we take the pressure off them and let the robots do the robotic and allow the humans to be the human? And that is the crux of 5.0. But this is incredibly serious because this might sound wishy-washy and charitable and everything, but no, this is where people are investing. And where you look at where the majority of new investment money is going in Silicon Valley, it's going into health tech. It's going in personalization. And when we talk about cures for cancer and we talk about new technologies around healthcare, it's all incredibly personal, which means our privacy data regulation needs to really keep up with some of the things that we're going to be capturing. And I'm not even talking about the current conversations around period and fertility app trackers that are happening after the fall of Roe versus Wade in the US.